Yeah.
But what they can prove is chiropractic adjustment actually reduces high blood pressure.
And welcome back to the Illuminations Media Network. This is Tamara, your host. And if you're back, thank you so much for hanging out with me for all these years. If this is your first time here, welcome and welcome. Dr. Brian Bussard is here with us today to answer some questions, to help us to get informed, because certainly if we know better, we can do better in all areas of our lives, whether it's health, whether it's finance, whether it's just seeking truth. And you know that's what Illuminations Media Network is all about. So without further ado, welcome.
Well, thanks. Glad to be here.
Wonderful. I'm glad you could take the time out. So I wanted to invite you on because I have very smart viewers who've been with me for a very long time. They wonder about the world, they wonder about everything, and I always promote the idea of questioning everything so that you can
As we all
learn.
should, all the time.
Exactly. And so chiropractic medicine is a science, it's a discipline. It's
Yes,
something
ma'am.
that a lot of people don't know about. And I just wanted to promote it because I've been using it for years. And I know that it works very well for me in so many areas. So I have a few questions for you.
Sure.
And I know that the viewers are going to also have some questions. Perhaps they will leave questions and comments in the chat below, and you can feel free to answer right here on YouTube or wherever you may be listening or viewing. Know that Dr. Brian is going to be diligent about responding. Excellent. So, first question that we want to get to is, of course, understanding chiropractic care. Maybe we can look at the history of, what it is, how it started. Yeah, let's start with that.
Sure, certainly. Well, chiropractic care is a form of healthcare mainly that focuses on diagnosing, treating, and preventing mechanical disorders. So anything that's related to the musculoskeletal system, which involves your spine, of course, all the muscle tissue, all the nerves. Basically, the premise is that your general health is controlled and affected by your nervous system. So the better your nervous system, obviously, the better your health, both mentally, spiritually, physically. So it all ties into anytime you can decrease the pressure off your nervous system, you're going to be just much healthier in the long run. Does that make sense?
It
So,
does totally. Well, one question before you
sure.
move on. Let's identify what the nervous system is. Is it electrical? Is it energetic? What is the nervous system?
Well, ironically enough, your nervous system is the only thing that's encased in bone. So it starts with your brain, turns into your spinal column, and all the spinal nerves that run throughout the whole entire body. So starts from the tip of your brain all the way down to the top of your brain all the way down to the tips of your toes. So that nervous system is encased in bone, so therefore I think would be pretty important, right?
Hmm.
So if we can dive into a little bit of what the history is. So way back in the late 1800s, 1895, as a matter of fact, when the first chiropractic adjustment was delivered, um, D.D. Palmer, which is a name that is synonymous with every chiropractor. You can pull any chiropractor and talk to them, call them, whatever, and ask them who D.D. Palmer is. And they should be able to tell you who D.D. Palmer is. If not, I would be really leery because then you're probably dealing with a chiropractor that doesn't know much history about his own profession, right?
Okay. Now, who is Dee Dee Palmer?
There were brothers, D.D. Palmer and B.J. Palmer. They were actually like the founders of chiropractic philosophy, basically. So way back in 1895, when the very first adjustment was delivered, it cured somebody's hearing loss. Actually,
Wait,
that
hold
was
up. Wait
yeah,
a
that was
minute.
the first documented case of a chiropractic adjustment. Somebody regained their hearing from that adjustment, and that's what's kicked off and started chiropractic
Wait a
in the
minute.
profession.
Now,
Absolutely.
how is that possible? How is your spinal column, which you've shared with us, is encased in bone, right?
Sure.
How does that affect the ear?
Well, you got your auditory spinal nerves that exit out your brainstem, basically, which sits right at the base. You can almost touch your brainstem if you like pushed hard enough in the back, where that
Okay.
little bump is in the back of your head. Just below
Yeah.
that, your brainstem almost sits down just above that. And so it's still
Okay.
encased in bone. It comes down and sits down as far as almost your foramen magnum, which is just above your atlas. And so you have these spinal nerves that shoot off, and so you have your auditory nerve. And
Mhm.
so basically, when you reduce the pressure off your cranial nerve, which is also right off your spinal cord, right off your right. So if you can reduce the pressure off your auditory nerve, you can remove the restriction. Therefore, you get your hearing back.
Okay. So visually, we're
Mhm.
talking about if something is going on there, the would it be correct to say that a nerve is pinched off? Mhm.
Yeah, it's pretty common to use that term in chiropractic care or
Mhm.
in the medical profession in general, just because they don't want to like. I think that's a poor way of explaining really what's going on. So
Okay.
when you compress any nerve, you're going to get dysfunction, right, or dis-ease, right?
You're
So
cutting
when
off the flow.
correct. So if you want to think of it,
Okay.
I like to think things really, really simplistically. So
Mhm.
think of like your light switch in your house, right? When
Okay.
you turn the
Okay.
lights on, power flows to the light source, right?
Yes.
When you flip the switch off, the lights turn off, right? So if you think of
Mhm.
that kind of simplistic model, so when you compress a nerve or pinch a nerve, you get you turn off the power to wherever that or diminish the power to wherever that nerve goes. In that case, in 1895, it was to the auditory canal or the inner ear, right, where you have your stapes and your hammer and everything that creates acoustic sound. So
Mhm.
therefore, when they reduced or removed the restriction on that cranial nerve, he got his hearing back.
That is powerful.
Oh, absolutely.
So so again, we're looking at the human body as having electrical circuitry.
Absolutely.
Wow.
So you may hear
Wow.
me around in my clinic when I do an adjustment. A lot of the times I'll say, "Oh yeah, we just turned your power on." Right? So once we reduce the restriction or remove the restriction off your spinal cord, voila, you just feel better, you move better, you think better, organs do better.
Yes. So we have nerves that, like you said in this first instance, that go to the ear.
Correct.
I would imagine we have nerves that go to the eyes, maybe
Correct.
that go to all the organs.
Correct. So what I try to explain a lot, and because I'm huge on education. The more you know, the better, right?
Better.
You can make the better things are because then you can make informed decisions and based
Mhm.
off knowledge, not off emotions. And so,
Exactly.
we all have an emotional side, but we all have a analytical side too, right? And
Mhm.
so I try to educate, educate, educate because I want you to understand that okay, just because you have so let's stay up there in the neck. Let's say if you have a compressed nerve in the neck and you have pain that shoots down the arm, right? Well, we know through gross human anatomy, which is a pretty cool class,
Mhm.
that those nerves go down the arm, but those nerves that are being compressed also go into the upper thoracic cavity. So what's in the upper thoracic cavity? What's in your chest?
Your heart, your
And
lungs,
yes, ma'am.
and what else is in there?
No, those are the two main things. That's it. That's the two main
Okay,
things.
okay.
Like, okay, you got your heart and your lungs, right? So when you have pain
Yeah,
shooting
yeah.
down the arms, coming from
Mhm.
the neck, we know that well, it can affect your heart and it can affect your lungs. So you might have anxiety type symptoms where you're shortness of breath. Your heart, you might have palpitations. That can be, there's a series of nerves
Oh,
in your neck and upper back from C5 all the way down to T4, T3, T4 that can affect all the upper thoracic cavity. So you got your chest, you got your lungs, you got your heart. So all that can be affected too. So chiropractic is a whole lot more than just back pain.
Right, right. Because that's how it is promoted. You see the signs along the road or the commercials. If you've had an accident or
Sure.
whatever, that the focus is on the pain. But
Right.
but the pain is a signal that lets you know something is going on.
Sure. Correct. And typically, most of the time when you have a symptom, your body is already 65% of capacity. So if
Mm,
100% is asymptomatic and pain-free, ever feeling good, great, right? It takes your body to get to degrade or degenerate those symptoms. Your body has to go all the way down to about 65% before you start to get the symptoms. So you're
whoa,
already way behind the game by the time those symptoms show up.
whoa.
The other thing I try to promote is um, it seems for the most part, it's nowadays it falls on deaf ears. It seems like, but don't wait because you
Mm,
don't want to wait till you have a symptom because you're already behind the eight ball when those symptoms present itself. Your body is already gone under a process of whatever it is that it's going through. Let's say, for instance, heart disease. Well,
mhm, mhm,
this is a big one I use in my office because I'm a huge fan of fish oils. So
mhm.
do you know what 95% of the time the first symptom of a heart attack is? 95% of the time.
Hmm. I would say low energy,
Nope.
fatigue,
Nope. It's worse.
pain.
Yeah, all these statistics that I'm throwing out here, these are you can take these directly from the American Heart Association right off their website. So the
Mm.
first 95% of the time, the first symptom of a heart attack is death.
What?
Yes, ma'am. That's why they. So when you have a
Silent
major heart
killer.
attack, or the widowmaker is what they call it,
Oh,
95% of the time, you usually don't come back from that first symptom, which is usually typically death because that's so sudden and boom, right?
so we're taught to think that pain is the first sign that there's dysfunction or there's something going on. It's alerting you, and then you seek help for it.
That is so far from the truth because your body's already 65% at 65% functional capacity before that symptom even starts.
Before it
So let's
even
say if
starts.
65%, so obviously zero is non-life, but look how much closer you are to you're closer to being something catastrophic happening than you are
Mm.
closer to being completely asymptomatic and healthy. Does that make sense? So
It does totally.
anything below 50%, I think you're in very bad shape. So like when you're at 65%, no symptoms show up. That's why I say don't wait until you have symptoms because you're already so far behind the game that now you have to play catch up. Where we spend the majority,
Mm.
like most Americans, spend the majority of their wealth in the final few years chasing that health. Well, if you could take a quarter of that amount of money that you spend in the final years of your life and push it more towards wellness type care, you would have a much better life.
So, doctor, if we're
Sure.
stepping away from that mindset that, okay, the symptom is telling me it's time to go take care of myself, right?
Mhm.
You're already, you know,
You're already
far
behind the
beyond.
eight. Yeah, you're
You're
behind the eight ball already.
already.
Yes,
So,
ma'am.
how can we stay ahead of the eight ball? What would be the suggestions of using chiropractic?
Well, like I said, the role of chiropractors is one to be a physician for like we talked about, the role of what we do and what we look for are musculoskeletal type problems. But
Mhm.
there's so much more to it than that through diet,
Yes,
nutrition,
indeed.
exercise. So
Okay.
health, in my opinion, does not come in a pill. Never has, never will. You have to, you know, pull up your pants, roll up your sleeves. You just have to do the work. You have to stay active through
Mhm.
diet, through nutrition, and through exercise. Those three components, keeping your spine in alignment. It's like I
Mm,
I always say that dentists have it easy because we're taught from the time we come out of the womb, right, that you got to brush your teeth every day, two,
every
three
day.
times a day, right? Every day,
Flossing. Yeah.
because you
Mhm.
want to prevent cavities, right?
Right. You don't have to brush all your teeth, just the ones you want to keep, right?
Right. That's that's funny. That's funny. But the same token is why don't we teach that about your spine? Difference between your teeth and your spine is to this day, I still don't think you can replace a vertebra.
You can't, especially if that power source is encased within that vertebrae.
Absolutely correct.
Oh
But
my
you can
goodness.
but you can get dentures, you can get, you know, implants
Yeah.
in your mouth, right? You can do all that stuff. But
Okay. Okay.
for the most part, you can replace a disc, but they still go in and they still fuse the segments, the two or three segments together, even though
Mhm.
they put a rudimentary fake disc or carbon fiber disc in there, right? But
Yeah.
it's pretty barbaric still. But
Mhm.
for the most part, you have to stay active in diet, nutrition, exercise. And I promise you, it
Mhm.
doesn't take much.
It doesn't
They
take much.
they
Okay.
want you to think it's hard to do because what do they want? They want you on the Lipitor. They want you on
Mm,
they want you on those medications because,
pharmaceuticals.
pharmaceuticals, it's $1 billion industry, probably
It
close to
is.
$1 trillion industry by now. So it's
Right.
crazy.
Well, we're all about taking care of ourselves.
Oh,
And
absolutely.
and this is revolutionary because I remember, growing up, you always hear that chiropractic is it's quackery, it's not real, and it is dangerous. Let us debunk some of the myths and the misconceptions about chiropractic.
Oh, like, well, where do you want me to start? Like
Well,
once you go,
the
you
popping
always
and the
have to go.
cracking.
That's funny. That's one of the biggest misconceptions too, is once you go, you always have to go, right?
Right,
So
right.
I wrote down some pretty cool stuff here on debunking chiropractic because there's always some where is it here? Give me just a second. I wrote down some really good ones.
Well, the safety concerns, again, I mentioned
Yeah, there's
earlier
a
because there are those sounds that sound kind of scary, right? The
correct.
popping.
Yeah, and that's actually a release of gas called CO2. So
Okay.
the same stuff in carbonated beverages. So if you ever had a soda pop, you would it's the same stuff, like the carbonation, right? And so what happens is when you get an adjustment, your body releases a gas, and that gas activates a couple different things to happen. One, it stimulates a healing process to
Hey,
go right where those pops happen, right? So
hey,
it's not going to last long, and I even hate to call it pops, but for keep it simple because simple's easy. Um, but when you get those pops, you stimulate healing to happen in that area. Your body will also release endorphins. We all know endorphins make you
mm,
feel good,
they
take
feel
away the
good.
pain. And the other thing, indirectly, I can't say it happens directly because I'll get in trouble, but indirectly, your body will start to create a low grade amount of white blood cells. And we all
Okay,
know
okay.
white blood cells, they help boost your immune system, right?
Mhm.
And so in the long run, chiropractic adjustments can actually help speed up your recovery of any kind of symptom that you might have going on. The typical back pain. You like my air quotes there? So, as far as back pain goes, but chiropractic is so much more than that because we envelop total body wellness versus
Yes,
mind, body, spirit. It's a whole lot more than just back pain, if that makes sense. And so
right.
some of the things that um let's go back even as far as 20 years ago. Um State Farm and Allstate and State Farm both came out with studies trying to show that chiropractic hurt people. And so the biggest thing that was going around is chiropractic causes strokes, right? They still to this
What?
day, yeah, they still to this day cannot prove that chiropractic causes strokes. But what they can prove is chiropractic adjustment of your C1, which is your atlas up there, actually reduces high blood pressure. That we
Okay.
can prove. That came out of the State Farm study and the Allstate study from 20 years ago. So that was
Mm.
even, I think, promoted in USA Today and all over the newspapers that chiropractic manipulation can reduce blood pressure. So instead of trying to create a myth, it actually was one of the things that we got to debunk and say, look, we have study after study after study that shows.
Hmm.
chiropractic care works. So, and I'm not going to sit here. This isn't a bashing session on the pharmaceutical companies because they have their place too. But
They
as
definitely do have their
far
place.
as
Yeah.
everything else goes, is, I would say when you have when you're afraid of, people are typically afraid of something that they know nothing about, right? And so if you would take
Exactly.
people would take the time to do the research and see that chiropractic is one of the most safe, non-invasive forms of healthcare that's out there. So
Mhm.
if you look at just go off malpractice. So malpractice is something that every doctor has to carry in case something
Mhm.
catastrophic happens, right?
Mhm.
And so the low man on the totem pole for chiropractic, or excuse me, for malpractice insurance are chiropractors.
Wow.
We have the lowest malpractice. Now, if you're a neurosurgeon, you probably have a super high
Yeah,
malpractice.
you would. Hmm.
OBGYNs, they have super high malpractice. And so
Hmm.
when it comes to being safe and effective, chiropractic is one of the safest forms of healthcare that's out there. So
That's right.
that's why we have with some of the lowest amounts of malpractice that's out there. So when
Hmm.
you look at, because everything is in the insurance world, everything's based on risk. So, yeah, of course, the more car accidents you're in, the higher the car insurance is, right? So when you're
Right.
dealing with insurance, the faster you drive, the more speeding tickets you get, the higher your insurance is. So when you're dealing with in the insurance world, everything is based on risk, and chiropractors
Yes.
have one of the lowest risk that's out there. Therefore, we pay some of the lowest premiums as far as malpractice insurance goes.
Excellent. Well, then
Absolutely.
I would say that chiropractic needs to be a part of everyone's wellness self-care protocol, just something that we do. You spoke about nutrition, about exercise.
Mhm.
Can you give us an idea of a wellness routine that somebody might, begin to espouse in their lives that would include chiropractic?
Sure. Well, obviously, the chiropractic adjustment, I mean, that's always going to be first and foremost, which I'm always going to recommend. If you're
Right.
not being adjusted, you should. There's always difference between chiropractors. Every chiropractor has a different philosophy.
Mhm.
My philosophy is you should never go more than 2 weeks without an adjustment. I
Two
equate that
weeks.
to you going like once a week brushing your teeth. You probably wouldn't do that. Okay. Just because like I said, the difference between the dental world and the chiropractic world is you can't replace your vertebra. Okay. And so um, when we're dealing with routines, the less stress, the better. So,
Mhm.
stress is a form of mental, physical, and, so when you're in the workforce, obviously we all have stress. So we
Yeah.
try to minimize the stress as much as possible.
Mhm.
Um, Stretching routines, diet, and then it all goes back to diet, nutrition, exercise.
Mhm.
So there are different things, a prime example is if you're doing exercise, you're working on core strengthening, flexibility. Those are just some of the two. Not as we get older, I know I've used this analogy before.
Mhm.
Would you rather be the oak tree in like a severe windstorm? Would you rather be the oak tree or would you rather be the palm tree?
I would rather be the flexible palm tree for
Yes,
sure.
ma'am. So that's
Mhm.
where as we get older, it's not so much about being strong. Yes, you will need some strength, but that
Mhm.
comes, with proper diet. But you want to maintain your flexibility and because you want to sway in the
Yes.
storms. So when we fall, as we get older, because one of the downfalls as we get older is we become brittle. And so when
Mm.
we fall, we break, right? And when we
Mhm.
break, then we get stuck in the rehab centers, and then we get pneumonia,
Mhm.
and then we die,
Oh
right?
no.
So what I huge proponent of is you got to stay flexible. So that's where the palm tree comes in, right?
Mhm.
You got to work on flexibility every day as
Mhm.
we get older. So it only takes non-exercise for 2 weeks, you can lose 20% of your muscle mass
Wow.
just in the middle of 2 weeks. That's
Mhm.
huge. And
Mhm.
so, in order to gain that back, it will take you weeks upon weeks upon weeks to gain that back. So that's why I say you got to, as we get older, we got to work on it every day,
Mhm.
every day. Um,
As you're explaining this, the connection between the muscles and the skeletal, it
mhm,
makes me think about pullers and levies, in the body,
sure.
right? And so you talk about making sure that you keep your core strong.
Mhm.
Um, how does that impact the vertebrae, the muscles? Can you give us an idea of that?
Sure. Well, as you as you stay flexible, so we'll kind of digress here a little bit. So
Yeah.
when you have inflammation in the body, that's when all the bad stuff happens, right? And
Okay.
so when you have inflammation in your arteries, it creates plaquing. Plaquing leads to strokes and or heart attacks, right?
Hmm.
When you
Hmm.
have inflammation around joints, you create excessive bone growth. We call that arthritis. It could become too much of that becomes detrimental, right? You have inflammation in the muscles. We call those myofascial pain syndromes. They can become painful. What's the most common one that's diagnosed for myofascial pain? If you know off the top of your head, do you know what that one's called? The myofascial pain syndrome, where you have like 20 different painful points in your body.
Fibromyalgia.
Yes, ma'am.
Oh
That's what
my
they call
goodness.
fibromyalgia.
Okay.
So one of the ways you can fight that is staying active. So when you have
Hmm.
inflammation, the only so you have your circulatory system, right? Those are for your blood cells. And
Hmm.
so
Hmm.
when you have inflammation, those tissues become swollen. And when they swell, they become too big. Those tissues, they become too big to jump back into the circulatory system. So the only way to get rid of inflammation is through the lymphatic system. So, but the lymphatic system is only activated through muscle contraction.
Movement.
Movement. Yes, ma'am. So that is why I will always say when you ice is important because ice will numb it. Ice actually creates
Okay.
a little bit of low grade inflammation itself. So when you
Hmm.
have an injury and you're icing, just know that, okay, yeah, ice is going to create a little bit of low grade inflammation itself. But what the ice will actually do is actually numb the pain receptors in that area. So then, let's say if you have a sprained ankle, most of the time the old school way was to put your foot in a bucket of ice, right? Like way back in the old school days. So you would completely numb it. So after 20 minutes, you can get out and you can slowly walk around because those pain receptors are numb. Well, what you're doing is you're making those little tiny muscles of the foot contract. You're making the
Right.
gastroc and the soleus muscle, the tibialis anterior muscle. You're making those muscles work in the lower leg that helps
Right.
push out the inflammation, which in turn speeds up the healing process. Going back to this routine of why you need to stay active, because when you're active, you make the muscles work and you create the good properties in the body to happen, right? So we can decrease inflammation, we can increase circulation, we can get the endorphins, and we can stimulate and stay flexible and maintain proper, I shouldn't say proper, a better health in the long run.
Excellent.
That's how that all ties together.
Excellent. You also mentioned the importance of nutrition.
Mm-hmm.
Mhm.
Diet, nutrition, exercise. Those are my three staples that like preach.
Mhm.
I'll stand on a soapbox, like mini soapbox, and preach that till I'm no longer with us. As far
Yes,
as
yes.
nutrition goes, just a good, sensible diet.
Mhm.
As since GMOs, it's really hard to have. I wish we could go back to the 1950s because health was much easier to obtain through food because of the non-GMO food. So now,
Right.
with the everything being GMO, it's really hard because that creates those GMOs create inflammation in the body, and so you have to be
Mhm.
particular with what you eat, and it's way more expensive to eat non-GMO food than it is to
Yeah, it
not.
is.
And that's by
Mhm.
design. In my opinion, that's by design. Um, so for the most part, nutrition, you got to supplement. You can supplement with, glucosamine to help the joints because as you get inflammation in the body, it attacks the joints. Collagen type 2, which is another good thing. So if you're going to take collagen, you may as well throw collagen, the complex in there so you can have nice hair, pretty skin, and pretty nails on top of good joints too. So you can get collagen one, two, and three.
Okay.
And just get the complex. And then omega-3 fatty acids, which are fish oils, because fish
Hmm.
oils are where do I start? There's so many good things to do with omega-3 fatty acids. But there's omega-3 fatty acids, fish oils, they can actually help with the inflammatory process. They're not an anti-inflammatory per se, but they do stuff in the cascade pathway, which is a part of the inflammatory process to help with inflammation, if that makes sense.
Okay.
So those are the three staples that I really promote in my clinic on a regular basis. So you should be taking omega-3 fatty acids,
Hmm.
glucosamine, and collagen. Just those three things alone, you're going to feel much better in the long run. I
Okay.
personally have been taking them for about 26 years. I don't
Okay.
miss them. I take them every day.
Now, what do we say? Is there any help for those who are vegan, who are completely plant-based with regard to these?
Yeah, there's vegan supplements out there. I go through Metagenics. I don't know if they've because I've never honestly never have had that come up in my practice. So
Hmm.
as far as um, I think their standard process in California, I think might have a product of vegan quality, but I'm not
Hmm.
sure off the top of my head. There's Metagenics probably does. I've just never asked them because it's never come up in my practice, honestly. But if I
Okay.
can get back, I will get back to you on that. How about that?
Okay. And then I will share the link so people
Absolutely.
can explore.
But yeah, I mean, there's all kinds of different. Um, Not everything is what it seems to be out there on the market either. So one thing I
Okay.
would pretty the reason I use Metagenics is one because they're a local company to Washington. They're out of Gig Harbor, so that's why I like to promote local if I can. Yeah, they've moved some of their stuff to California as far as their processing plants, but for the most part, they're still a local company in Gig Harbor, and their products are pretty good. But the other thing they do is what most companies don't do is called assay testing, ASSAY. So they hire an independent third party company to come in, grab their product, and test it for what's on the label. Does
Okay.
that make sense? And
Yeah, it
so
does.
there's only a few companies in the United States that do that.
Hmm.
Last time I checked, there was, I think, three companies, and one was Standard Process in California, I do believe, and the other
Hmm.
is Metagenics. I can't remember what the third company was just because I've never done a search on there to see how many companies do that. I just know Metagenics does it. And so you'll see a little like emblem on the bottle that says assay tested.
Okay.
The reason that all is such a big deal, because if you go back, I want to say, God, I'm aging myself now, 15 years ago, maybe, on the Brazilian diet pill, there was two girls that died on the same day from taking the Brazilian diet pill.
Mm.
Well, it turns out that it had ephedra in it, which
Oh, yeah.
stimulated their hearts, and they died from but it wasn't listed on the bottle. So ever since then, I've
Oh,
been a
goodness.
big advocate for assay testing of any kind of vitamins or anything that you get out there on the shelf.
Excellent.
Um,
Excellent.
so yeah,
Well,
diet, nutrition, exercise.
now, another tip, we were speaking about the muscular and the skeletal last few years since the pandemic that we went
Mhm.
through. A lot of people are working from home. Maybe a lot of people are sitting in front of their computers working. Um, what about ergonomics and posture? How does this play?
It's gotten worse since people have what I've noticed
Mm,
is, working from home. I would much rather see people go back to work because their workstations were much more ergonomic than hunched over at a kitchen table with books
yeah,
underneath their laptop or whatever. So
right, right.
um, I'm a big fan of working from home. I haven't found out how to do that yet or do telehealth yet, but when I
Right.
figure out how to like teach people how to self-adjust, yeah, no, that'd be great. But ergonomics are, I always say the 90-90 rule. So, you want your monitor to be eye level or slightly up. and then you want your hands, your elbows at 90 degrees, your wrists 45 degrees on your keyboard. So everything's going to be like 90 degrees. And
Mhm.
so, and then your feet up off the ground, or, your legs slightly elevated if you can while you're
Mhm.
typing on your computer. So yeah, ergonomics are huge. Absolutely. One of the bigger, um, one of the biggest reasons why poor ergonomics is the reason why like over 8 million Americans have chronic low back pain every day,
Yeah. Yeah. Yeah.
which is huge. Which leads me back
Mhm.
to, take frequent breaks, proper ergonomics,
Mhm.
do the Mexican hat dance, just get up for 30 seconds, do Mexican hat dance around your chair, and then get back down. At least you're stimulating some kind of movement in the joints
Movement.
before you don't have to take a 20-minute break. Just get up, dance around your chair for 30 seconds and sit back down and get right back to work. It's really that simple. But we all
Yes,
get ingrained,
indeed.
and next thing we know, it's like, holy crap, I've been sitting here at the computer for 3 hours, right?
That's right. And
So it's,
something that I've noticed with myself is that I have a tendency to move my neck forward
mhm.
when I'm sitting there.
Sure,
And I'll notice that I have to stretch more
sure.
because I
If
tend to
you're
do that.
a real incidental finding that has been noticed over the past probably 10 years is, um, because Americans spend a lot of time on their phone looking down, right?
Looking down.
So you have a little nuchal ligament that, so if you touch the back of your skull, you feel that
Hmm.
little bump back there. Feel
Yep,
that
the
little bump.
hook.
So just below it, there's a ligament that attaches to that little bump,
Huh?
right? And so from the constant looking down at the phones, looking at computers, so over the years, that ligament calcifies. And
Mm.
so when we take x-rays and we have to look at the lateral curvature of the neck, we see that in the back of their head right there, we're growing horns.
Oh no.
Yeah, it looks like
Whoa.
it seriously looks like a horn that we're growing out the back of our head because that ligament is calcifying.
Oh my goodness.
Yeah, so that's kind of incidental, but
Hmm.
for the most part, yeah. So frequent breaks, look up, ergonomics. So
Wow.
one thing you can do, this is a little pearl that,
Okay.
I've just started to incorporate, is because of the nature of everybody's work, is to do what we call chin tucks, where you just take your
Okay.
chin and you push it like you're trying to push your straight back. Yeah, and what you should do is you should feel a stretch in the very back of your head.
Mm-hmm.
Yeah, and you can sit there and do that all day long. Yeah, almost like you're
Okay.
doing the right, but just kind of push. And so that's some of the exercise I've now started to incorporate, where for people who need to really work on promoting a C-shaped curvature in their neck. So those are part of chin tucks,
Excellent.
which will help the curvature in your neck.
Well,
Absolutely.
that will really help. That's a
Hmm.
jewel, everyone.
Oh,
Begin to do
absolutely.
those chin tucks. Yeah.
Absolutely.
Well,
Um,
Dr. Brian, I'm just so grateful that you took the time.
absolutely.
As we wind down, is there any question that you wish I had asked? Anything that you would like the listeners and viewers to know about chiropractic?
Yeah. So one of the things that, I wrote down some other stuff here. Some of the things that are kind of more so going towards the like technology, right? Everything advances like as
Yeah,
we get closer to the end of every year, technology 10x's itself, right? And so we
doesn't it?
get advancements and everything else. But when it comes to good old fashioned spinal care, there's nothing that's really better than the good old fashioned chiropractic adjustment. Yes, we got decompression tables. Yes, we have laser light therapy. Yes, we have infrared therapy. We have all this stuff to help facilitate health, but there's nothing that will replace getting that good old fashioned chiropractic adjustment where you get that cavitation or the pop that helps stimulate healing within the body. So,
Mm.
um, until we find stuff that will actually do that, again, I'll till the day I die, health does not come in a pill. It actually takes work. And so, that work is actually getting up, taking your bottom into the chiropractic office, getting that adjustment. And so
Mhm.
I know the adjustments don't last long, but those doctors have spent 8, 9, 10 years training to deliver that adjustment so you can reap the benefits of what happens when you get that adjustment. Does that make sense?
Yeah. Yes.
So,
And remembering that again, by the time you feel pain, where are
oh,
you?
absolutely. Yeah, don't wait till you have symptoms because you're already behind the eight ball. So
Mhm.
that's
Mhm.
crazy. And the only other thing I would say is if you're not on a nutritional plan, um, we can help you get on one as far as supplements. On my, um, I pass the savings on to all my patients. So, the patient, if your people are interested, they can always reach out to me at Dr. Brian at palmerchiropractic.com, and I'll send them a QR code to get the benefits of the fish oils and the glucosamine and the collagen. So again, I just pass all the savings on to my patients because it's not for me. It's more so about creating health and wellness than it is about robbing your pocketbook. Because healthy patients refer healthy patients, right?
Yes.
And
Yeah.
so, and when you really focus on caring for people and have a genuine attitude towards that, people are smart. They pick up on that, and that's what our clinic's all about. Like I said, we have a lot of 5-star reviews. So we take pride in helping people and not trying to, get them in and out, in and out, in and out.
Mhm.
So
Well, we can definitely sense and feel, we can feel the energy. It's coming through that you really do care, Dr. Brian. And
absolutely,
I thank you so much for joining us here on the Illuminations Media Network. Hopefully, you'll come back again. I'm sure there'll be some
absolutely.
updates.
Um, yeah, I'll tell you what. I'd like to come back and talk about some research and stuff from what we found from. There's a just a recent 2 articles that were done by chiropractors out of Colorado as far as motor vehicle accidents and how we can prove that when you lose the integrity of your curvature, it is due to the whiplash trauma that you take in the car accident. And so we can actually prove now without a shadow of a doubt, because the insurance companies like to say, well, there was no damage done to the car. Well, that's because the patient absorbed all the damage. And so
All
now
of it.
and so now we
Mm,
have evidence to prove that yes, hey, when you have ligament damage and you lose the integrity of your curvature, we can actually prove that it was done by the accident. So there's some pretty cool studies that just came out that I'd like to share if you don't mind.
oh, certainly. Well, we'll definitely have you back very soon. But what that says is if you're in a car accident, see a chiropractor right
Absolutely,
away. If you've
absolutely. The
got
sooner the
pain,
better. The
you're
sooner the better.
already too late.
Yeah,
All right.
there like I can bring you all kinds of studies, but typically when you have any kind of like trauma or any kind
Mhm,
of accident or something, the sooner you take care of the symptoms, the
mhm,
faster you heal, the less expensive it is. The longer you take, the
mhm,
longer it takes to get you well, and the more expensive it is. So
mhm.
don't wait.
Excellent. Sage advice.
Absolutely,
Appreciate it. All right.
absolutely.
I thank you all for joining us here. We thank Dr. Brian. Until next time, here on the Illuminations Media Network, this is Tamara signing off. Peace and blessings.